Hi, how are you? This video is about trauma. Not so much what trauma is or where trauma comes from or the usual stuff that I post about. More focused on current examples through contemporary medical disciplines that exist that we can use as conceptual processes and systems during this guided integrative process of actually incorporating, integrating, processing, dealing with our lifespan trauma. Basically, in a nutshell, this video is about the systems that already exist that will help you to realize if you think you can't be helped, you can be helped. And this video will be the proof for that. Now, I've got notes here, so I'm going to be looking down just to make sure that I keep my points of reference every now and again. I'm going to talk about two different medical disciplines that some of the models used in these disciplines are conceptually extremely relevant, right, with how the process of trauma can actually be healed. The first one comes from psychiatry. More specifically, it comes from Dr. Joseph Wolf. I don't know actually if that's how you pronounce it, but Dr. Joseph Volp. Dr. Volp developed a system to treat predominantly phobias and anxiety disorders during the late 40s and 50s. This process is called systematic desensitization. What it comes down to, effectively, is a 3-step process. Number 1, you're shit scared of something. What do? You figure out in a controlled, calm, safe environment what is the trigger. Number 2, once again, through guided help, you develop coping mechanisms and systems that are primarily focused on helping you relax and stay in a relaxed state. Then number 3 is the systematic re-exposure to these triggers you already scare the shit out of you. Now, why is this important that you get re-exposed? Because as some of you might know, the fact that trauma has such a lasting effect on our lives is because of our avoidance of the pain, right? But by continuing to avoid the pain, we actually never deal with it. We never feel it, we never process it, we never integrate it. So it stays there, and every time it gets triggered, it reactivates. The effect of this particular process when it comes to anxiety disorders is it's guided in such a way that it helps you to stay calm in the process of changing your reactive behavior, which you've practiced so many years already, into a more healthy, long-term, real-time, very important, real-time response. So this is the one side from psychiatry, systematic decentralization, developed by South African, by the way, Dr. Joseph Volp. The second area that I would like to bring into this video comes from immunology. Now, immunology exists for, I think, 1885, around there was the first time that we basically discovered when an outside threat attacks our internal environment. So the discipline itself is longer, it's older than 100 years. Specifically related to allergy treatments. Now, just a very brief explanation. What is an allergy? What is an allergic reaction? Now, some of you might already know an allergic reaction is when our body, our internal environment, translates some external stimuli, which would normally be classified as not threatening, as dangerous to us, as threatening to us. So what does our immune system do? It attacks it, right? Because it's something that's dangerous. So naturally it attacks this. Are you starting to see where I'm going with this video? Common and most contemporary, or that's not the word I'm looking for, common and general, I suppose, yeah. Process structure for treating allergens, this is where I go to my notes, is based on 3 different factors as well. Surprise, surprise, what is the first one? What are you allergic to? So identification, right? Identification, for those of you who have had the battery of tests for allergies. Skin irritations, basically, on your back, usually. Bunch of stuff. Are you allergic to this, and this? Number 2, once we have the result of what one is allergic to, it comes to the specific treatments available. Now, number 1, it's recommended to avoid whatever it is, right, that is causing this internal mechanism to activate. Now, as you might very well know, when it comes to trauma, this is the very first step we naturally take. We are adverse to pain. We are not pulled towards pain because that shit hurts. So we naturally try to avoid it. Now, the problem, of course, is the longer you avoid it, the longer it stays there. Okay, it builds up pressure until you explode systematically, and then the process resets. So number 1 is avoidant in the treatment of allergies. Number 2 is medication. Come on. How many of us have been on medication or are still on medication in order to help us deal with the high intensity stressors we continuously experience on a day-to-day life based on unresolved and unintegrated childhood, adolescence, and adult traumas? Many of us. The third part, which is the part that I like, is immunotherapy. Very much the same as the third stage in the process of systematic decentralization. It focuses on slow re-exposure to whatever the substance is that is triggering your body into believing that it's being attacked. So quite literally, we get exposed on a continuous basis with the purpose of your body realizing, listen, this keeps happening. Eventually it realizes it's not a threat anymore, and then it learns to respond differently and to build up a natural tolerance and immunity against this. Now, what is this about? Not taking any more of your time. This is about, there are ways of dealing with your pain and your trauma. If you think that it's not possible, then with all the respect on this planet, I am sitting here looking at you, telling you that this is something you think. If you open yourself up for new possibilities, and if your pain has become bigger than your fear of change, then it is possible. This whole video was just about explaining that to you. Take care.